Hello everyone, my name is Marcy Young and I'm a student at Indiana State University. Today we're going to talk about the importance of human papillomavirus vaccination. First, let's please pause for a pretest. Our learning objectives today are to identify what human papillomavirus or HPV is, learn what HPV causes in humans, learn how HPV spreads, learn how HPV vaccination works, learn the importance of HPV vaccination, learn who is eligible to receive the HPV vaccine, and learn where the HPV vaccine is available. So who is at risk for HPV? Everyone is. Males and females are both at risk for HPV, and those who are sexually active with more than one partner are at higher risk. HPV is human papillomavirus and is most often a sexually transmitted virus and has over 200 similar viruses that can cause genital warts and several types of cancer in humans, including cervical cancer, vulvar cancer, vaginal cancer, anal cancer, penile cancer, and oral cancers. The CDC, or the Centers for Disease Control and Prevention, estimate that around 85% of humans will get an HPV infection in their life, and that HPV infection causes around 36,000 cancer cases in males and females in the United States each year. So, how is HPV transmitted? It's most often spread sexually through oral, vaginal, or anal sex with someone who has HPV, often doesn't know it, and often has no symptoms. So how does HPV vaccination work? Vaccination protects us from diseases. So the HPV vaccine protects against getting infection from HPV that causes genital warts and those cancers we talked about, the cervical cancer, vulvar cancer, vaginal cancer, anal cancer, penile cancer, and oral cancer in males and females. It cannot cure or treat HPV infection once you have it, and that's why it is so much better to prevent it than to treat it. I just want to repeat that one more time. The HPV vaccination cannot cure or treat HPV infection once you have it, and that's why it is so much better to prevent it than to treat it. Is the HPV vaccine safe? It has over a decade of research and it's licensed by the Federal Drug and Food Administration. The importance of HPV vaccinations. CDC estimates that the HPV vaccination can prevent over 32,000 of the estimated 36,000 cases of cancer that occur each year from ever developing by preventing the infections that cause those cancers. So it really could mean life or death. So who's eligible to receive the HPV vaccine? Well, children age 9 up to adults age 45 can get the HPV vaccine. Remember, it cannot cure or treat HPV infection once it has occurred. It can only prevent it. So that's why it's so highly recommended for children in that 11 to 12 age bracket before they become sexually active. And those that are age 9 to 14, they only need 2 HPV vaccinations spaced 6 to 12 months apart. Those older than 15 up to age 45 will need 3 doses given over 6 months. Those who would not be eligible for the vaccine would be those younger than 9 and older than 46, those who are pregnant, those who have a yeast allergy, or any who'd had a previous serious reaction to an HPV vaccine in the past. So where can you get an HPV vaccine? Most private medical physician offices, community health clinics, county health departments have the HPV vaccine. Some additional resources, the CDC, the Food and Drug Administration, and the National Institute of Cancer are all good websites. And here are the references that I used today. And now let's go over the post-test together. See how we did. So number 1, what does HPV stand for? It stands for human papillomavirus. Number 2, true or false? Treating cancer is better than preventing it. That would be false. Preventing cancer is better than treating it. Number 3, who is at risk for HPV? Everyone is, males and females both, and those that are sexually active with more than one partner are at higher risk. Number 4, true or false? HPV vaccination could be the difference between life and death. True. Number 5, how does HPV spread? HPV is most often spread sexually through oral, vaginal, or anal sex with someone who has HPV, often doesn't know it, and has no symptoms. Number 6, true or false? Males and females are both at risk for HPV, and those who are sexually active with more than one partner are at higher risk. That would be true. Number 7, what is a vaccine that can help to prevent genital warts, cervical cancers, vaginal cancers, vulvar cancers, penile cancers, anus cancers, and oral cancers in humans? That would be the HPV vaccine. Number 8, true or false? Those younger than 9 and older than 45 are eligible for the HPV vaccination. That would be false. It would be those older than 9 and older up to 45 would be eligible. Number 9, can HPV vaccination cure or treat HPV infection? No, it cannot. Remember, it can only prevent it, and that's why that age group of 11 and 12 is such a crucial age to get the vaccination before they become sexually active. Number 10, true or false? County health departments offer HPV vaccinations. That would be true. So how did you do? Thank you very much for taking the time to go over this with me, and have a good day.